You know, this state is like in a crisis right now.
Yeah.
You know, it's really bad. I think that people don't know the severity, how bad it really is, where, you know, we're at 100% in this building here and no one's talking about it. You know, we have to come with a goal and a plan to figure out, you know, what we can do to make this better. And unfortunately, you know, the inmates, they get tested every 30 days, so they're not the ones who's bringing it in. So I think that the officers need more training where the you know, the COVID-19 it's at the highest peak right now. You know, so it must be addressed, you know, to the American people of Rhode Island, that they should know what's going on and have a plan that we talked about, you know.
Yeah, we're going to need you to step up close to the mic.
Okay.
We can hardly hear you, though.
Can't hear? Okay.
Yeah.
It's okay, I didn't know that.
Yeah.
I'm going to get ready to start.
Okay.
Do you mind starting from the beginning, the same thing? Just
Absolutely, absolutely. Absolutely. So, good morning, guys. My name is Brother Gary. I'm the director, Black Lives Matter Rhode Island. And, you know, we've been getting calls, a lot of calls based on me keeping the data of what's going on with the COVID-19 in Rhode Island. So, maximum security is at 100% capacity right now, and of COVID. You know, they're not giving out the actual numbers on what's going on and the deaths that's going on, so they've been carrying them out of here too. So unfortunately, you know, they're at 100%. We need some things to happen dramatically, you know.
So, my name is Mark Fisher. I'm a director at Black Lives Matter Rhode Island. And so we understand that it's 100% infectious rate here at maximum security. Medium is spiked as well dramatically. And we understand there's over 600 cases right now. 500 of them are with the inmates, around 100 are with the COs, with the guards. And like Brother Gary said, the inmates aren't the ones who are bringing this in. And a spokesperson for the union for Department of Corrections admitted that the administration has dropped the ball. They have not put a safety plan in progress or an isolation plan to protect these inmates.
Right.
And obviously they can't manage it itself. We know it's not a hoax. We know people are actually being hospitalized. We're at capacity here in the state and people are dying. So it's not a hoax, it's not gonna go away. And the negligence that we see is almost unbelievable. And why does it seem that at the expense of colored people, always we wait till the last minute to do something, to take preventative measures, to act bold, and to act decisive to protect the most vulnerable of our population. It's a state of emergency right now. We know the state has filed for emergency relief, pretty much moderation of the bail guidelines because it's so severe right now.
Well, as we know,
Tell us your name.
my name is Carl Jefferson, a pastor here in the state of Rhode Island, and we are concerned because we have family members that are housed in these houses, this house of correction. There are 57% of incarceration is due to having black and brown people from the state. And so there are family members, there are children, there are fathers, there are mothers that is attached to these facilities that are now at risk of contracting COVID. And we know that definitely it is a disproportionate number of black and brown that are getting COVID. And so we do need to be concerned. This is a healthcare crisis. Rhode Island now is #1 within the nation where the numbers are rising. And so we have to be concerned. We're also concerned, as Mark has already stated, with correction officers because they are attached to families as well. And so this needs to be something that we're all concerned about, because at the end of the day, all lives do matter. And so we are concerned, and as a pastor here within the state, I am concerned morally of how we look at this, because we cannot judge those that are incarcerated based on whatever the reason why they are there. Most of them are there because of the policies in place that have kept them from being able to have adequate wages and health care and certain things. So some are there because they don't have a place to live, and so they commit a crime just to have a warm bed and a place and a meal. And so if we're judging them based on that, then there is a problem. If we allow a healthcare crisis to continue within these facilities, then it's a moral crisis, and it is immoral to allow this to continue to happen, because the scriptures would have it says, as we have done it for the least of those, then we're doing it for ourselves. So it is a statement about how we feel about our state if we allow the least of these to not be cared for. And so that's why we, a religious community, along with Black Lives Matter, stand together in solidarity to say that we have to be concerned and we have to have a voice about these issues that's affecting those that incarcerated. There cannot be close to 200 people positive and we be okay with that in a facility that's housing 700 and something people. That is a problem.
Give a description about what we talked about, the actual.
Hi, I'm Bernice Morris. I'm the policy advocate with Black Lives Matter Rhode Island. And, you know, I don't need to reiterate what everyone said here, but clearly they fell down on the job here. The fact that it spread so quickly and that there is now nearly 100% positive rate within these walls is unacceptable. And there's things that they could do, right? There's things that they could do right now. They could send people who can go home, send them home, because clearly they can't keep them safe in these walls. They didn't isolate people correctly. They didn't care for people, spread them out the way that they should have, and that's why it spread so quickly. So they were not equipped. And they could send people home, right? There's people inside these walls that could get released and get the care and the health care that they need, right? And that would stop the spread not only here, but also in their families and everyone that's coming in and out of this building every single day. And the other thing is that they need to take care of the fact that they're incarcerating people at such a high rate. Like, they could do something different around how people are being pushed through the courts and being incarcerated. So we're standing outside maximum security, but it's not just a maximum security issue. It's a corrections issue in all of the buildings, in all of the prisons. So they need to do something different. They need to grant people early release if they can, immediately, right now. They need to also give people personal recognizances if they are eligible, which many are. And don't use the fact that they are black or brown as a reason to lock them up. When someone else with skin like mine would get personal recognizances to be able to go home and stay safe and keep their family safe. So those are two things that we know. The administration has been super quiet about this. It's like just blew up over this past week, but this has been coming. Everybody knew that this has been coming, and now we stand out here because the people that could do something about it didn't do anything, and they let it get this bad. So,
and they're not planning on doing anything unless we apply this type of pressure. And we know that the administration is not planning on doing anything unless we apply this type of pressure. Like I said, the state public defender for the state filed a motion to let the inmates go home on personal recognizance, unless there's extraordinary circumstances which must be stated. And unless we see that happen, we'll know completely that this is compliance, they're complicit with this wild negligence.
and you know, there's things that they could do right now in terms of what they're doing inside this building, and that's have a plan. So now, like, isolate people, sanitize the building, do the things that we hear about, but we don't hear anything about what's happening. It's a state of emergency. Everybody's out here talking about it, but We want them to tell us what is the plan to keep people, to stop the spread of COVID-19 inside this building.
Something has to
and
be
to
done.
keep people safe.
What do you,
That's what we want to hear.
what do you have to say to people at home who are watching this and they say, look, this is a maximum security prison. People in here are in here for a reason. Why do they deserve early release because of COVID?
Well, they deserve early release if they're eligible for it. You know, I don't know all the details, and like I said, it's not just a maximum security issue. This is a corrections issue. So, you know, I'm not going to get in the weeds about like particular cases, but I'm sure that there are people in here that could be moved to another facility or go home for early release. And what I'm saying is that corrections needs to look at it and make any change that they can to get people home if they're eligible.
What have the conversations between you guys and the inmates? What have those been, and how are the inmates feeling right now in terms of this outbreak?
Right. So we've been getting a lot of calls, right, for a few months now, based on the actual numbers of New England and Rhode Island. The inmates have been saying, hey, listen, I think it's rising in here. We need to do something fast immediately about the spread and the outbreak. Now they're at 100%. That's the worst possibility for anything. That when you look at the numbers, they're staggering. Where a lot of countries, a lot of prisons is bad, but this is the worst. As far as numbers and statistics right now, when you look across New Orleans, they're high. The Rhode Island is the highest right now at 100%. So we could do the numbers on that.
Can you get into any specific conversations with anyone you guys have had inside the prison walls? How did they describe the conditions like?
Go ahead. Yeah. So
I don't know, but we know that there are challenges with congregate care settings of all kinds, right? We know that, but it's not. We're 10 months in to this pandemic. Like, clearly they could have done a better job. Other congregate settings are managing this much, much better than we've seen in Rhode Island Department of Corrections.
From what I understand, I spoke to somebody who works with a private company who delivers the tests. And from what I understand, he has told me that the tests are delivered at most once a week. There's no mandate on masks among staff or prisoners. And PPE is not readily available. And the staff have to be forced to take these precautions reluctantly. So there's no mandate, there's no urgency to prevent the spread. So what we want is two things. We want an isolation and safety plan for these prisoners.
that's right. That's
And
right.
we want release of prisoners that are eligible for it. Those are the two things we want.
Brother Mark, are there some inmates that are members of Black Lives Matter?
No.
Why is that?
Because we want to work with them. You know, when they come home, we have different we have a few programs that's target for them to help them out when they be released.
But could they be a member inside?
Yes, they can be a member. They can, but it's more, you know, where we're helping the inmates. You know, it's lack of advocacy in Rhode Island for inmates. So we want to demonstrate that hugely. The last one was like open doors. You know, so now that we're coming, we have a new philosophy and a new understanding of education for inmates. So we would love that, to work with them. Yeah.
Are you encouraging, Brother Gary, any of the inmates for any type of disobedience, like a hunger strike or anything like that?
No, we're not. We just want to do our groundwork. You know, like Steve said, you know, that's the most important thing. Get the message across and what's going on outside and worry about what's going on inside. So we want to help.
Have you reached out to the governor or to the attorney general about this?
No, I will, though. This afternoon we will. You know, we had a conversation a few weeks ago about, you know, I think we should come up with a plan, you know, an action plan, and make sure that this doesn't happen again. You know, these are human lives. We're talking about human people that are in there at 100% capacity. That's amazing. So we're really concerned about the health and welfare of these inmates.
The 100% figure you used, you're saying this facility is at 100%?
It is at 100.
Capacity, it's not 100% infected. It's not what you're saying, right?
No, it's almost at 100%. Yeah, it's
It
at
is.
80.
It's very close
It's
to
very close to
100%
100%
positive rate.
right now. So it's going to be, and maybe next week it might be 100. So
In these type of conditions where the prison quarters are so tight, and also people have underlying health conditions
Right.
and pre-existing
Right.
conditions, it's only a matter of time. It's inevitable
Right.
unless something is done.
right. So
You talked about some discriminatory practices with respect to personal recognizance.
yeah.
Do you have statistics say on like, the numbers of cases where black, brown people were denied the personal recognizance?
I mean, when you look at-
and
Right.
rights were given.
So when you look at the stats, right? Let's just say,
You have those stats?
no, it should be online. It's something that we all know. That when it comes to African Americans, we're one of the highest capacities in prison around this country. We have the capacity of almost 2.5 million people that are incarcerated, African Americans. So those are the stats, and those numbers don't lie.
We house 25% of the world's prisoners in this country. Developed country like the United States.
You said you're going to reach out to the governor or attorney
Yes.
general later?
Yes, we will. Yes, we will.
And with those specific asks?
Yes, those are the demands that we would like to see happen. So, definitely would.
I basically just want to say to the Lieutenant Governor, Brett Smiley, and to Governor Raimondo, as you release these prisoners, early release, you're sending them back home into the pandemic with their family. So my concern is, how do we, when they're early release, find a place that they can go and get rehabilitated before sending them to their family infected? That's my concern.
Tell us your name.
Aisha Hall.
Thank you, Alex.
Let me just also go back to that question about maximum security. We're not advocating to let criminals go who have committed crimes. However, we do need to be concerned with humanity. Even though somebody may have committed a horrendous crime, they're still human. And we don't have electric chairs, we don't have death penalties, so we still have to treat people as people regardless of what they're in there for. And so if people are concerned of trying to malign the message about we are advocating letting criminals go, that is not what the message is. However, we should be concerned about their health, their safety, because at the end of the day, they're still human. At the end of the day, they still have families. And at the end of the day, we can't judge anybody because we all have the ability to do whatever they may be in what they have done.
Under the right circumstances.
Exactly. And due to poverty, due to systemic racism, due to policies that have been put in place, there is a high percentage of black and brown that are incarcerated. As of 2017, 57% of those incarcerated are black and brown. So that is a high proportionate number when you look at what is the proportionate number within Rhode Island as per capita. And so we have to be concerned because behind those doors, all lives do matter, and the percentage of that is black lives and brown lives. And so if we don't say nothing, woe unto us. And as we get more information to know what is the issues behind those doors, then we will advocate all the more. It is sad that we now have to find out that 80%, that's a huge number. May not be 100, but we hope not 100. But if we're at 80% already, and we are 9 to 8, 10 months into this, then we are even challenging the Department of Corrections. Where was the policy in place from month one? Because we knew eventually we would possibly get here, and we being at 80% where other neighboring states are at 30 or different percentages, something's wrong with that. And that lets me know that we may not care about those because they may not look like those who are setting the policies. And so we have to be concerned. And so we stand for those who can't stand. We speak for those who can't speak. And we will also protest and really state what the needs are in there as we find out. And so this is to be continued. We're not done yet.
Pastor, you think it would be a different setup if all the inmates were predominantly white?
Gary, you can answer that.
That's a hypothetical that's not even
If they was all white, it would be a different.
realistic.
I mean, we really talk about the numbers and the disparities about black and white people and the portion about how we're treated in America. So this is how you explain to the world what's going on with black and brown people in America. It's really self-explanatory. So the more we focus on color, the more issues that we're going to have, and that we need to highlight those things. That we're at 80%, almost 100% capacity. That's horrible. We need to look at those numbers, 80%. So I advise for the state to do something about it. I think that we should be more advocating more about this problem that we have, this pandemic. Slow it down in there, because we want those prisoners to be released, if non-violent ones, especially, So let's make a plan, an action plan that fixes, like, immediately. Thank you guys for coming out.
Thank you.
We appreciate it.
Thank you guys.
Keep advocating for the people that don't have a voice. We appreciate it, guys. Thank you, and God bless.